Hello guys, my name is Isaac Simple and Real. Thank you for tuning into my channel kindly. If you have not yet subscribed to my channel, please subscribe, like and share. This is a channel where I should talk about issues concerning averting HIV and sexually transmitted infectious stigma in our society. And we usually say that being positive about HIV is not necessarily being HIV positive. Welcome. Guys, also if you have not yet subscribed to my channel, this is another time that I'm requesting you that you kindly subscribe to my channel and also click the notification button so that you'll be enlightened when we upload our new videos. Thank you. Today allow me to talk about genital warts. Genital warts is such kind of a condition that have affected so many people, and they tend to hide it just because these warts have developed on your genitalia. Most people become skeptical and they do not seek treatment. But guys, did you know that genital warts can be treated? Yes, genital warts can be treated. I'm talking about the condylomata acuminata. That's the other word that the other name of genital warts. Basically, genital warts are caused by a virus called human papillomavirus. Basically, subtype 6 and subtype 11. What happens? Human papillomavirus, when it gets into you, either you are a man or a woman, mainly for men, I have not yet seen most cases, but it's very common in women. Especially for men, I have come across in my practice some warts around the scrotum, but very rarely do men get. Also, even cancers that are caused by human papillomavirus, penile cancers, very rare. But now, let's talk about genital warts, especially in female, because this is very common. Most of women have experienced this. I'm not talking about the warts that usually people experience on their face, although even the facial warts can also be caused by human papillomavirus. Let me talk about genital warts, because this is what most people have been suffering in silence without knowing that there is some treatment that they can be offered at healthcare facility. Number one, how do you present with genital warts, or how do I know that I have genital warts? Genital warts appear like growths. So you'll get like finger-like projections. Some of them are even bigger. They can appear like a skin projection that is a bit soft, or some of them may appear a bit firm along the genitalia. They may appear, for the female, you may appreciate them along the labia majora, that is the external genitalia of the female, labia majora or labia minora, and even in some cases, though very rare for me, honestly I have not experienced this one, but you cannot also experience them along the vaginal wall, but in rare circumstances. But most commonly you find them along the labia majora and labia minora. Now, sorry for the background noise. I have some kids that are talking behind my office, but I believe you are understanding me. Now, what happens when these growths develop? For example, for the pregnant women, I'll talk about those who are prone to genital warts. They have some implications. Now, uh, how do you present? I have already talked about it. These finger-like projections that usually appear like cauliflower, or so they may appear highly vascularized, so they may appear a bit pinkish, and others may appear a bit darkish or bluish. So that's how these growths of genital warts present. Also, I'd like to say that most genital warts are benign, which means they are not cancerous or they are not malignant. Are we together? However, they cause a lot of discomfort and they may affect even the decision of your childbearing. The doctor may prefer you deliver via CS just because of the genital warts. So they have some implication about your health and decision about your childbearing. Now, who are prone to genital warts? Basically, any person can get genital warts, especially high probability of acquiring genital warts, women. But in most circumstances, men are the people who carry the human papillomavirus, but they are asymptomatic. So the men can transmit the virus sexually to the women and make them or increase their chances of acquiring genital warts. Now, I've seen high possibility or high probability of acquiring genital warts is a female sex or female gender. Number 2, having an immunosuppressive disease. In this case, we are talking about cancers, we are talking about diabetes, we are talking about hypertension, especially diabetes, HIV, and cancers. They increase your chances of acquiring human papillomavirus. And by acquiring human papillomavirus, chances of genital warts manifesting in you. Are we together up to this point? Thank you. Also, another thing is that when you have genital warts, now, if your immunity is low, their growth increases. Even some of them, the external genitalia, the female external genitalia, appear ragged just because of these, the anatomy of the female genitalia is distorted by these growths. Just especially when their CD4 count is very low, or when the immunity is very low. The other thing is that when you have genital warts, the esteem or the sexual drive, sex drive, is pulled down. So you will not be enjoying sex just because of the disfigurement of their external genitalia. Also, even a man may not feel comfortable to have coitus with you just because your appearance is not appealing. So it has some implication when you're suffering from this condition. However, there is a mode of treatment when this diagnosis is confirmed clinically. So because most of these diagnoses we make them clinically, treatment can be initiated. So if you are HIV positive, we consider initiating you on antiretroviral therapy, and also there are treatment that we use. Example of them is like examples of podophyllin therapy, either a combined podophyllin and another drug, or just podophyllin cream only. Alternatively, we have other drugs like imiquimod, which can also be used in the treatment of the same. So these are just but some of the treatment that we employ for people who are suffering from condylomata acuminata, or in other terms, the genital warts. So guys, if you are scared about the condition of the external genitalia, please, you may be having a condition that can be managed. I have seen people whom we have initiated on care who are suffering from genital warts, and they recovered. So I'm saying something that I've witnessed, that I've prescribed, and someone got treatment. So these are just but some of conditions that we are going to discuss in this channel. So please get posted so that you may continue learning, and also we may continue empowering each other to seek treatment when we are suffering, and also just for checkup. Just develop that habit of seeking care when it is due, not waiting until a complication arises and you have no alternative other than just seeking the treatment. Remember, prevention is better than cure, and also we can be able to discuss other things that are very important about our health and also our well-being. And that's all for today. God bless you. Kindly, if you have not yet subscribed to my channel, please subscribe, like, and share. My name is Isaac, simple and real. Goodbye.